I'm Dr. Vivek Nangia. I'm Chief of Pulmonology for Max Healthcare Cluster 1. I'm also the Principal Director and Head of the Department for Pulmonary Critical Care and Sleep Medicine at the Saket Complex of Max Hospitals. So none of the tools and diagnostic methods that are used in the private sector are different from the public sector. They're just the same. Clinical diagnosis followed by radiological diagnosis in terms of X-rays, CT scans, whatever is needed. And then finally, a microbiological diagnosis is very, very essential to get to the exact diagnosis of drug-resistant tuberculosis. The microbiological diagnosis would start with a simple sputum examination, or if there's any other extra pulmonary involvement, then the fluid to be taken from that side and then to be tested. This we also subject our patients to bronchoscopic examination if sputum is not being produced and the sample is inadequate. Ultimately, the sample that is collected is then subjected to various tests that include the smear examination, cultures, Gene Expert Ultra, Haynes 1, Haynes 2, line probe assays. So all these tests are conducted equally well in private sector as well as public sector to get to the diagnosis of drug-resistant tuberculosis. So ever since the new drug-resistant TB guidelines have been issued, which include the use of bedaquiline, and unfortunately bedaquiline is not still available in the private sector. In a way, it's good also that it's a restricted use. So nowadays we send most of our patients to the nearest drug-resistant TB centers only, where they can be managed properly with the shorter regime, which is bedaquiline-based therapy, which is easily tolerated, and it's a shorter duration course, and the response rates are also better. So, well, there are certain private hospitals where they have opened drug-resistant TB centers also in coordination with their local TB officer, and I think some of these centers are doing a really good job, and where the microbiological examination is also conducted free of cost, as well as drugs are also provided free of cost. They have an access to bedaquiline-based therapies as well. So these models are really very successful and are doing quite well. So best is to refer them to the right center, the drug-resistant TB center, where they can be provided with free of cost treatment, as well as there's a government scheme where they get 500 rupees per month for extra nutritional supplies that they can obtain. And also for better monitoring, better care, it is best to refer these patients to a recognized center, established center, rather than giving them a treatment on your own. TB is a fully curable disease. You should take proper, adequate treatment whenever anybody is diagnosed to be having TB. If they take the treatment properly, the disease can be eradicated completely. However, if they take the treatment irregularly, default on the treatment, then the disease usually doesn't go and becomes difficult to treat. Therefore, it is very important to be consistent with the treatment and complete the course of TB medication.